And the examination revealed there is a papular rashes and fine peeling on the external surface of her knees and the elbow joint. The area of her follicles are the wax color and nodules that rises from the skin, and the clinical signs are caused by the insufficiency. So there is insufficient dietary intake. The examiner has asked you. So see guys, actually this type of question is very important for Croc 1, Croc 2 panel, and even any medical exam you give in the worldwide. So I think you should know something very important here. One by one, like before going to the next option, I just for the explanation, I want to give you the short review quickly, that just who want to skip this question. Like the given condition is for the definitely papular rashes, peeling of skin, and there is like knee problem, and there is going to the dermatologist, dry and peeling skin, so it is scurvy. So no doubt answer is the ascorbic acid, vitamin C. But now look at very important. I want to just revise your things, like how you can approach to the other options and what are the key factors regarding your final exams. That here, that pyridoxine is basically it is a vitamin B6. Retinol, everyone knows it is vitamin A. Ascorbic acid is C. Riboflavin is B2 vitamin, and thiamine B1, famous. Each of them has been asked in the exam many times. What keywords you should remember, that whenever pyridoxine deficiency will be there, so the patient will have the symptoms like hyperexcitability, vitamin A associated, the patient will have the vision issue, vision problem. Scurvy, given condition, same as in the above question. Vitamin B2, or we can say the riboflavin deficiency, there is a two paralysis will be in the question. B1 thiamine, very important for the basic metabolism, but the given condition will be similar to the polyneuritis. Okay. Now this few keywords is important for the this particular type of question, how you can differentiate like what has been asked. Going through the common concept, that when we say that something is vitamins stand for the vital amines. So vital amines is very important for our body, and we can have the we need to just go through this particular type of this component we should consume. Now here shortly, just I want to tell you that these are the organic compound, and this is the must be taken by the diet. So it is the organic compound, first point which has been asked. What other points has been asked, like how it is what to say, like was discovered, that is very, but it is not that much important. Vitamins are basically divided into the two categories. The first one was fat soluble, and the second one is water soluble. Now just I want to mark, actually this is a word which everyone like most of us know, but here what you have to remember, most of the time fat soluble vitamins which cannot be excreted from our body through urine or through the stool, that is why hypertoxicity symptoms like hypervitaminosis. Yes, see. Okay. Now there are the total 13 vitamins known, which are or fat soluble is vitamin K, vitamin E, vitamin D, vitamin A. Okay, and there is a total, because it is 4, so there is a 9 water soluble. So here, like if it is 9, so 1 is vitamin C, and remaining is 8, that is vitamin B, out of which B1, B2, B3, and so on. Now, what happened that like what important thing you have to remember? Hypervitaminosis most of the time with the fat soluble. And the second option, like second thing, which you just need to remember, that while going through this kind of questions, like these questions will have the generalized symptoms for you. Like here it is given the insufficiency, that is why you go for the scurvy. But I just want to mark here why I'm telling this thing, because every time you are not going to be asked with a basic question. Sometimes it may be related to the toxicity, like the over consumptions. So how you will differentiate with the over consumption of the vitamins? So vitamin supplements, first of all, they are the natural substances which can be purchased in the pills and the capsules, powders, liquids, and that they have the well balanced replace with the healthy diet. Now the next one, there is recommended allowance according to the given recommended dietary allowance, that is RDA, that is equivalent to the sorry, equivalent to your like how much you get. Now, multivitamin should contain like multivitamin capsules. These are the water soluble vitamins: vitamin B1, B2, B6, B12, niacin, biotin, folic acid, pantothenic acid, and also there is vitamin C. And they also have the minerals like zinc, copper, and magnesium. These are the most commonly affected with, or elements, most commonly associated elements in the multivitamin capsules. Now going through the next one, here the name I want to tell you, that B1, B2, B3, just I want to make it clear for you to remember. Just remember this chart, actually it is very useful and give you the quick answer, and it is for your exam it becomes very easy. B1 stand for the thiamine, B2 stand for the riboflavin, B3 niacin. There is no B4, there is B5, that is pantothenic. And there is B6, that is pyridoxine. And there is B7, biotin for our hairs. And there is B8 for, sorry, not B8, it is B9 for the folic acid. And then there is B12 for the, what is the B12 name? This is here folate or folic acid. B12 itself is a methylcobalamin, cobalamin acid. Now this is simply you can remember like this part. And as I have told in the beginning, that what are the different structures, and now just remember this chart, and these names are important which I have told you here. Okay, moving to the next question now.